have 3 of them. Those basically they are all on board. We have a private institutions too, Crawford. We've had a series of engagements with our state Ministry of Education. We look forward to a favorable outcomes for that. For our facilities, we deal with about 500 of them, PHCs. In fact, we started with PHCs because Mr. Governor initially was like, no. In fact, no private for now. Let us kick off. But on demand again and geographical spread, we had to involve our private facilities. And as of today, we have 120 of them actively working with Oxia. Next slide. All right, this is not just to bring about figures. It is just to inform us that we, in our own little way, and also in compliance to the NHIA mechanism, we are also good on the monitoring and evaluation. So on a monthly basis, we analyze our encounter rates, and from there we get the service utilization rates also per facility, per local government. No need for papers. Next slide. Okay, so this is what the utilization rates looked like last year, and this specifically for BACPF. Like I said, it's just to show us what we do, especially in our MIE unit on a monthly basis. So at the end of the year, we could say for the whole year, this was our utilization rate. For each month, this is it. For each quarter, for each local government, this is what utilization rate is. Next. Successes, well, the formal sector is a big one for us. It's being launched. On the awareness, we had to engage Odunlade Adekola. Of course, he's resident in Abeokuta. So we go on radio shows, we go on road shows, and that helped at a point in time. Our claim system has been fully automated, reducing all the time lag and paperwork. 24-hour call center, we can beat our chest to that, and that has also helped. We are actively present on social media, and we are also proud to say we are represented in all 20 local government areas of the states. Next. Before I move to the challenges, there are other key things I would like to chip in. For us at Ogun State, we are now engaging traditional rulers, politicians, and what have you, who come and they buy lives, and also to promote them and give them that sense of Nigerian. You know, I told you we customize their cards if on request, so that has also added to that. We are also big on our community structures, the WDCs. We are as active with them as this my phone. So the various WhatsApp groups I know, we engage them. They bring up any issue, we respond to them immediately. In fact, for virtually all categories of stakeholders we have them directly here. So there is no coming to the office, writing letters, just drop it, and someone from the office is actually attending to whatever issues. For the enrollment, also we have our presence physically, digitally across the state. We have our third-party agents working at the local government level. We have marketing agents. These are individuals. And we have currently about 50 TPAs enrolling from different sites in Ogun State. Okay, and for the challenges, the voluntariness per se, you know, the law says it is mandatory, but there's no enforcement. So for operationally, it is voluntary. So that has been a big issue, and that has resulted in the adverse selection I narrated earlier. The premium for now is not aligned with economic realities, but there's little we can do for now. NHIA, I mentioned how they are now a threat to the ecosystem of health insurance in Ogun State. Drug stockouts, this we've been able to tackle to an extent, especially with facilities offering BACPF. We've had to intervene, procure drugs for them, and that's drastically reduced the issue of drug stockouts. But occasionally we still have complaints here and there. And this last one is a big one. It should be in capital letter. At Ogun State, we do not have a supporting partner. Next slide. Thank you. Thank you very much.
Thank you very much, Ogun State, for the presentation. Thank you very much, sir. Thank you. You mentioned Odunlade Adekola there from Ekiti State on loan to Ogun State. Have you known me so? from Ekiti, but on loan to Ogun State. Like my former commissioner, Mr. Akimade, my former commissioner, the longest serving commissioner for information on Ondo State, is now on loan to Ogun State as information advisor to the governor of Ogun State. Ogun State, they like, I'm alone now when you're sort of, yeah. I saw my guy last week in Lagos now, Mr. Akimade Asoro. Munima down para Ondo State. Abi, ela I'm on low. Eroni, I'm on low Ondo State. Yes, this is Ondo. This is Ondo. A round of applause for Ondo. Ondo is next. 10 minutes. Sharp, sharp. 10 minutes. Sharp, sharp.
Okay, Ondo State, Amalo. Yes. Anyway, so thank you very much. Adopting the already established protocol, I am Dr. Ekunda Oluwole. I'll be speaking on behalf of the Sunshine State of Nigeria. Yes, 10 minutes. Am I worried? You will be overwhelmed in the next few seconds. But I'm actually impressed with Lashma, and I've challenged my brother there, Dr. Olamiji, that in the next 2 years, Lashma will be coming for tour study in Ondo State. Okay. So, welcome to Ondo State. So, the Contributory Health Commission was established in 2019 by law, and we commenced full action about 2 years after, and we started with the formal sector scheme of the state. And our aim is just to provide health insurance for all residents of Ondo State, and we run 3 schemes at the moment. One is the Orange Health Insurance Scheme. You should be on slide 8, please. Orange Health Insurance Scheme for the formal sector, and about 9 months ago, the governor, Dr. Lucky Orimisun Ayedatewa, launched the informal sector scheme of the Orange Health Insurance Scheme. We also do the Abiyamo Maternal and Child Insurance Scheme, which is a continuum of the ABA program. Because someone mentioned ABA the other time that, okay, it has left. No, it has not left. It is now Abiyamo, and it is still fully functional. Then we also do the BHCPF program called the Ilera Loro. We have to, culturalize and domesticate the name so that the people in the rural area can relate well to what the scheme is about. So for the Abiyamo Maternal and Child Insurance Scheme, it was flagged off in 2019, and we have about 55,557 people that have benefited from it. Out of this, we've had 18,305 babies, 5,107 cesarean sections, 436 twins, 11 triplets, and 2 quadruplets that have been actually delivered through this scheme. And everything is an equity scheme being paid for fully by the government without no cost to the residents of the state. Now, for the BHCPF, which is the one that is generalized nationwide, 1% of the consolidated revenue funds of the country, we have, for Ondo State, we have 82,662 vulnerables under it, divided across, the vulnerable people living with disabilities, the orphans, the elderlies, even sickle cell warriors. As at now, we have 405 sickle cell warriors under the scheme, receiving cares at domiciled primary health care centers across the 203 wards of Ondo State. Now, we have partnerships with Clinton Health Access Initiative. Sorry, Ogun State, we have partners, sorry. So for the Orange Health Insurance Scheme, the formal sector, which was one of our biggest stories, at the moment we have 103,738 public servants and political office holders on this scheme, and they're enjoying services from both government and private-owned hospitals across the state. At the moment, about most of the facilities are actually government facilities, 27 of them, with private being 2 and 20, and 3 tertiary centers. But we have good relationship with Afebi Babalola University Teaching Hospital, Obafemi Awolowo University Teaching Hospital, and even University College Hospital, Ibadan. We sometimes get our enrollees referred there for specialized care, and the cost is still on the commission. We send them there for renal transplants, for complicated surgeries that actually need seasoned consultants in those teaching hospitals. We also work with the Federal Medical Center, OWO, and very soon we'll be working with the FUTA Teaching Hospital here in Akure. So our enrollees, the public servants that are actually in our own Lagos and Abuja liaison offices, actually benefiting from the schemes too. We enrolled them and placed them under some health facilities in their location. So I'm sure you'll be seeing this is the picture of the governor about 7 months ago when he came to launch the oranges for the informal sector. Those babies with him, they are not virtual babies like we always say. They are the Abiyamo babies. Those babies are listed their number. Those are some of them enjoying, getting good pictures from the governor, the special advisor, the deputy governor, and even the DGs. So our target, like my director general will always say, is that we want to ensure at least 1 million enrollees under the informal sector scheme by 2027. And thank God my NMA chairman is here. We want to say that Ondo State, about 2 months ago, actually had an informal strategy, both planning and dissemination. We had it in collaboration with Clean Tea Health Access Initiative. We sat down, the airgates sat down to think of how we can actually imbibe the informal sector. What are the strategies? We did some research in some local governments. We know how much these people are willing to pay for this informal sector, and we're actually working on. At the moment, we've enrolled over 200 people over this scheme, but we're working with the artisan groups because they have the number. We're also relating with the internal revenue scheme. We're trying to do what Lagos has done to ensure that some things are compulsory. You should have a compulsory health insurance cover before you can make some statutory registration in the state. So that's why I said Lagos very soon will still be coming to us. So bar this, we have other innovative story. As at now, but by July 1, the contact center for the State's Contributory Health Commission will be launched. It's a 24/7 contact center, which are actually being domiciled and controlled by seasoned health professionals, which is going to be very, very active very soon. Now, one of our corporate social responsibility, one of them is the hospital intervention program, which is one of the innovative ideas people can get from Ondo State. What we do is we support some of these government facilities to revitalize and revitalize their health facilities. If you look at this is the NHIS clinic for one of our hospitals. After the intervention program, it was renovated to this. Please, both the former and the, please can move. Yeah, this is one of the buildings, one of our state specialist hospitals. With the hospital intervention program, it was revamped to this. Please, more pictures, more pictures. Yeah, this was the launching of that program with the SA, the DG, and the directors in the state and permanent secretaries. So please, we can move on. Yeah, anytime I see this picture, I'm always overwhelmed. Look at a patient that left his house to get care. Look at them, patient relatives or even patients standing by the window to get their card. Some even have to squat on the floor. So we have to create this reception for them in all of our teaching hospitals where people stay, and it is fully solar powered and automated where people get to rest. So please, you can move on. Yeah, this is also the picture. Yeah, also the Ganifawe Health Diagnostic Center in Ondo was also renovated. Please move on. And all these facilities are actually solar powered. Even the laboratory at the SSH Akure, formerly known as Mother and Child Hospital, through this intervention program, we revamped their laboratory. Everything is now fully automated, both chemical pathology, microbiology, hematology, and morbid. So everything there now works. This is SSH Okitipupa. Through the hospital intervention program, we provided with them solar powered electricity. Revamped their building. These are insurance. So when you go to the hospital, you feel like you are home. You get the best of care because apart from getting to the hospital with your illness, you can acquire hospital-acquired infections, So, but when you have somewhere you can actually trust, somewhere you can actually have the feeling that, I'm home, then it's even part of psychology. It's part of psychological treatment for these patients. Now, we've actually had over 72 medical outreaches. There is I am bold to say it, there is no government function in Ondo State today that the contributor to not be there to do medical checkup. And I want to give that applaud to the Director of Occupational Health. We are always there. If you see the governor is going to Elijah, we will be there with him to do, to check people's blood pressure, their body mass index, their sugar level. And we also, some of them, we even take them to the hospital when we notice absurd numbers to get immediate medical attention, all free of charge. So we've seen at least as at today, being the head of PRNS, I actually have the numbers, which is about 3,104 people have actually enjoyed our medical outreaches in the state. Then other things we've done, 28 people have had dialysis sections, over 8 people have MRI and CT scan, and actually ensure that at least one Neroli have actually had a renal transplant under the scheme. Then, please, to the awards. You can see from the slide this was the 2024 Public Service Award. The Ondo State Contributory Health Commission was actually given this award by the public health sector in the state. We also got an award from the International Federation of Women Lawyers gave us an award. We also had an award as the Best Health Insurance and Managed Care Leadership Award of Excellence, other awards for the state. But now, it's good to say these things. Does not mean we don't have our challenges. One thing about Ondo State is we might not be financially as buoyant as Lagos State, but we are trying our best to ensure that our hospitals are well equipped, both with staffs and with equipment. That means as of today, over 4,000 doctors in Nigeria are actually domiciled in Lagos. And in Ondo State, we are less than 500. So they have so many doctors. Of course, population in Lagos is about 22 million, Ondo State is about 5 million. But when you compare it, you see that we actually have paucity of medical personnel. So it's actually affecting some of these service deliveries. But like I said, I was discussing with my friend at that time, the best way to sell health insurance is not just by branding bosses. The best way is by service delivery. If you get to the hospital today and they treat you well, they don't collect a dime from you, you do all your surgeries for free, you will get home and tell your friend, you tell your church members. That's the best way to sell health insurance, and we're working on it. Like the special advisor, who is ably representing the governor, said the other time, we are recruiting medical personnel at the moment, revamping primary health care centers. So those are ways we collaborate and ensure that people get the best of service delivery in the state. You can see pictures of our medical outreaches, our doctors, our nurses. So at the moment, we have over 240,000 households currently enjoying health insurance, with no financial risk in the states. And we want to believe that in the next 2-3 years, we would have enrolled over 1 million, ensure that the hospitals are actually giving them the best. And does not mean we don't go for quality assurance. We go there, we ensure that places that are lapsing, people that are not doing these things, they are being sanctioned, they are being warned, they are being corrected. And we've also, worked with community pharmacists. So now, even if you get to the hospital and you don't get to get some drugs, we can actually get referral to a community pharmacist where you get your prescriptions to you, all being paid for by the commission. And we are working very closely with the Ondo State Drug and Health Commodity Management Agency, the DMA. They ensure that drugs go to the hospitals under hospital management, but every month. Then, one of that innovative things we are working on is that our claims now are all internet-based. There are no more paper for us. It's now software. We use software for our claims. And we are currently working on the medical app, which is going to be a medical app we want to adopt in the States, that we have your blood pressure, your BMI, your sugar level, that will be monitoring. If, as at when these numbers are beyond what it should be, it will trigger the hospital you are enrolled in. By the time the hospital is triggered, they will call you in, they will do a checkup and place you on medications immediately. Those are the innovative things we're also working on in the state at the moment. So I want to always just indulge us that this collaboration must stand. I am from Ondo State, I am living in Ondo State. If, for example, I get ill and I'm in Oyo State, I should be able to enjoy these benefits too, which is the aim of this conference. So I want to believe that very soon we'll have this integration among all the 6 states in the Southwest. Thank you very much.
Thank you. Thank you very much, Ondo. Thank you. Just spent 15 minutes. Thank you. You don't lie. 15 minutes now. Yes, next, Osun State. A round of applause for the Executive Secretary. Osun State. Imole.
Yeah, thank you very much. Yes, I think, how many minutes do I have? Okay, I'll see if I can manage in 9.5 minutes. Next slide. The Osun State story. Well, needless to say that OIS was established by the Act of Parliament, started in 2018. Next slide, please. And the journey was as displayed. The bill, 7th Assembly, law was passed October 2018. and it was assented by the governor and gazetted on the 25th April 2019. Next slide. Yeah, there was release of takeoff grant, and there was acquisition of offices, equipment, and the rest. Next slide. The benefit package was done by actuarial analysis, and we set the individual premium at 12,066 for the informal sector, and 57,600 for a family of 6, mother, father, 4 children below the age of 18, with 10% co-payment on drugs. Next slide. Well, in the law, the equity grant for vulnerable is set at 2%, but just like so many other states, I don't think this is coming forth for now. The law puts for the formal sector, 1.5% of their basic salary, which is matched by 3% of the basic salary by the government every month. Next slide. A lot of advocacies, media communication, social media communication on the importance of health insurance for people to buy in. And this has significantly yielded a lot of positive results for us. Next slide. We have a functional website, and quite a lot of our activities are there. We have a 24-hour call center that you can reach anytime, and we are proud of that. Next slide. A total of about 332 primary health centers are partnering with us. They're working for us, and you will note that in Osun State, the government has embarked on complete renovation of all these 332 focal centers. And we are having the support also from BECPF. We have 17 government secondary healthcare centers working for us too. Next slide. We have a teaching hospital, that's the Union Teaching Hospital, and we have, well, this statistic was at last year, November. Presently, we have about 125 private hospitals working with us. These are our enrollee statistics for now. Vulnerable, 94%, and 94,183. Incidentally, the BHCPF is catering for just 41,000 of this enrollee. The formal sector and their dependents, 98,000. Informal sector, 10,000. And the T-shift, 76,000. Something particular striking about the informal sector, I came in on board about 1.5 years ago. And the time I came in, it was about 2,000 that you have in the informal sector. And after about 6 months, we have more than 70% attrition rate. So it means we have to drive the informal sector aggressively. And there are quite a lot of things we did. We went to politicians. In fact, I had a special session with the House of Assembly, having spoken at the background with the speaker before going there, that they must do something. And at that session, at least about 10 honorable members adopted sponsoring 100 people from their constituency. From there, we went around to other well-to-do people in the state. We went to the Pilgrims Board, and we pleaded with them that when people are going on pilgrimage, let them insure their family. So part of what they do when they go on Christian pilgrimage or Muslim pilgrimage is that they must show evidence of insuring their family. It's just 57,600 naira, and that will be part of what they do. So quite a lot. Then we have a lot of radio drama, jingles everywhere, and people are now beginning to trust the system because the service delivery is also on the high side. Next slide. Yeah, the milestone. Also, when I came in on board, I have almost 1.5 billion naira debt that I met. But so I approached the government and said, we have to clear this, otherwise it will give the government a bad name. We also moved to We completed the abandoned office complex. Before I came in, it was completed. It was commissioned by Mr. Governor. Then I found something, that there were quite a lot of loopholes. For instance, in Osun now, we don't deal with HMO again. HMO were doing a lot of our operations then. Claims management, even payments. And I found out that there were actually a lot of loopholes. There were a lot of connivance between hospitals and HMO. And I studied the trend. Well, the same set of hospitals that every year this one gets every month this one gets 4 million, this one gets 5 million, this one gets for fee for service. And I felt no. I had a meeting with the HMO. What were they doing that was special that our staff could not be trained to do? And I found that nothing spectacular. So we trained our staff and we automated our system. So it was the system that was doing the claim for us with the guidance of our staff. And we reduced a monthly payment of about 43 million naira to 9 million naira every month. So that gave us some leverage to tell the government that no, the HMO is not important, and up to now is not. Now we have even gone beyond automation of our system. We have also adopted artificial intelligence, though at a low level. So now if you go to the hospital, if an enroll goes to the hospital and gets out of the hospital, in the next 10 minutes, you will get a message from the AI that you have just visited ABC Hospital. What was your experience? Whatever complaints you gave, the AI will give you. In fact, now we have trained the AI to recognize my voice and some other people in the agency. So if you ask a question, the AI will call me and say, somebody ask a question, who responds? If I say I want to respond, the system will respond to the person, but will mimic my voice. So the person will say, oh, it's actually the ES that answered me. And that gave them some confidence. You understand? But it was the machine that is the system that is answering. So we've gone to that level, and quite a lot of time now the AI collects information for us and can give us insight into possible endemicity. We started this about 6 months ago, and we just did a quick analysis around April and gave us the possibility of a gastroenteritis endemicity in one area of the state because of the complaints that people were giving in the hospitals around that area. So you can collect the data and can say there is a possibility that 70% of people going to the hospital within this period are having this diagnosis. So it can give us insight that there is a possibility of an endemicity in that area. And we can quickly address that before the whole thing happens. So that's what we have also done. Next slide. Yeah, when I asked the governor that I wanted board, it looks absurd that a lot of CEO will prefer to work without board. But I said I need guidance so that I don't work. So we have set up and inaugurated a governing board for Hoshia. In fact, that's the only MDA in the health sector that has a board in Osun State. No, others have board, but they only have board chairman, no board members. But we have a complete board at Hoshia. We also set up the Research and Ethics Committee because we want to put our stories where I come from, the academic environment. I was in the university before I was appointed at ES. So we want to put our data into stories. We want to publish what we are doing, put them together so that the whole world can see. And I'm happy to tell you that between last year and now, we have published about 8 papers in international journals. Yes, we have times that hospitals will run out of drug. That, okay, this month, this is on the 15th of the month, we don't have drug, we don't have money. We run a DDC, that's Drug Distribution Center, where you can come to get all the drugs you need so that you won't have to tell the patient, the enrollee, that you don't have drug. Get all the drugs you need, and we deduct from your capitation when we're going to pay the next month. So we run that. Next slide. Yeah, we visited a lot of hospitals and we asked them. Normally we have quarterly providers forums meeting where we interact with all our facilities, healthcare facilities, and know their problems and try to find solutions to them. We have said that it's not an excuse that you don't have a centrifuge. That is why you cannot pick anemia and somebody will die of anemia in your hospital. It is not an excuse that you don't have a glucometer, so you could not pick somebody with diabetes before you go to the theater to operate that person. No. So we told them that all of them, all the hospitals, let them give us the list of all the equipment they need to make their hospital functional. And they have done that. So we got all this equipment for them through bank loan, but not at a higher price than what they will get it outside. If artery faucet is sold at 200 naira outside, you're going to get it from Oshia at 150 naira. So it pays you to buy it, and you're also going to get it as credit from us. So we did that for all the private hospitals, and for the government hospitals, we asked the government to provide all this equipment, and this were done by the government. Then we have regular training and retraining. Our advert is almost second to none when you compare OSHA with any MDA or ministry in the state. We have all the radio stations in the state constantly saying something about HOIs. Because a lot of people don't understand there is an insurance policy. For instance, somebody came to my hospital one day and told me, "Doctor, I have not used the facility before I became here. I've not used the facility for more than 2 years. So I need Bonfita, I need Milo, I need MIC." And I said, is that part of prescription? So how will I prescribe that? Bonfita, TDS, or Milo, VD? So people need to know and understand that it's an insurance policy and they have to stay by that. Then we also have some part of our budget here marked for catastrophic medical conditions. And these are conditions that necessarily, without intervention may cause the patients their death. We have sponsored about 6 patients for kidney transplant under this catastrophic medical condition. Thank you. We have also sponsored about 2 people who have complete hip replacement through this condition. Now, when you have to, if you want to catch a monkey, you have to behave like a monkey too. Before I used to have a very big tummy. So one day somebody asked me that, why do I have very big tummy? And that was the answer that I'm a gynecologist. I treat a lot of pregnant women, so I have to look like them. That was why. That was why I had big tummy. Now that I'm in insurance agency, the tummy has gone down. Maybe you have to oil the ego of the government before you can get something from them. So we approached the government and we told him that, please, the pensioners, they have worked for the state. Now they are old. The little they are getting, don't let them spend it on health. Let us enroll all the pensioners into the health insurance scheme free of charge. And that we're not asking for any money, that we have been able to save some money to do this. You see, the government will give express approval. Initially, the statistic we got was 10,000 pensioners. But when we started the enrollment, we discovered there were 23,000. That there was a contributory pensioner and a non-contributory pensioner. But we still went ahead and enrolled all of them, all the 23,000, into the Osun insurance scheme, free of charge. But that's not even the story. Every day, people retire, and as they retire, they run to us that we want to benefit from it because they are not going to pay the 10% co-payment for the drug. It is entirely free. And this is a stage that's non-communicable, is on the high side. Diabetes, hypertension, arthritis, cancer, and things like that. And if they are not paying for that, it's a lot of succor for them. As at now, we have registered about 25,000 pensioners. When we did that, immediately, because I'm a Rotarian, we contacted Rotary International that please, we have this group of people who need urgent intervention. They asked me, how much am I bringing? I said, okay, the agency is bringing 1 million. So they merged it with 4 million. And we had free surgical intervention for these pensioners, the senior citizens. And we treated about 1,200, I mean, close to 1,900 of them. Next slide. After that, we approached Mr. Governor again and told him that people with disability are Arawani. Arawani, boboye, Arawani. Keni mano boboye, Arawani, Arawani, boboye. Yes, that was the song that I sang to Mr. Governor, that they also showed their franchise during the election. Let us also extend the hand of fellowship to them. There was one particular case that was pathetic, and that was even why I went to Mr. Governor. A woman that was pregnant, she was deaf and dumb, got to the hospital. The husband was also deaf and dumb. He got to the hospital, was complaining. Nobody understood what she was saying. The doctor, the nurses, the social workers, everybody was just looking at them. And out of frustration, they left the hospital. They got back home. Middle of the night, she started bleeding, and she bled to death. So when that story got to me, I said, no, this must never happen again in Osun State. So the first thing...
2 minutes more, sir.
Yes, okay. Okay, that is not actually going to be enough, but I will try and summarize. So we trained interpreters, distributed them into all the hospitals so that when people like that get to the hospital, they can get attention. And we enrolled about 9,500 people living with disability into the scheme. Not only that, we provided them with life support gadgets, wheelchair, walking stick, hearing aid, etc., that will make life good for them. Now, recently, I used my example that if I were to have a high problem when I was in secondary school, primary school, I'll probably not have become a doctor, because I'm that type of people you call backbenchers. We're always sitting at the back. So if I could not see what the teacher is writing on the board, it's likely that I will be failing. And we discovered that quite a lot of students are failing, not because they are not intelligent, but because they have poor eyesight. They cannot see what the teacher is writing on the board. So we approached the government and we said, we want to screen all the students in the public schools. Give us the go-ahead. We screened about 450,000 students in public primary and secondary school. And alas, we got about 45,000 of them that had visual problem, and they could not see. In fact, during the screening process that I was going around, I got to some centers and I asked the teachers to also read the Snellis chart. I found out that quite a number of teachers too could not read. They also have high problem. But what we did was that we provided solution for all these students that have ocular problem. Majority of them, about 42,000, needed corrective glasses, which we provided. Some needed drugs. Some needed surgery. In fact, there were 4 of them that had almost total blindness. 2 of them had complete retinal detachment, and we are undertaking to do the surgery for them. 2 of them have been sent to centers where they're going to have the surgery done. So if you have all this, to the glory of the government, you can be sure that they will also respond. And I will tell you that now, out of the 2% consolidated revenue that they are supposed to be giving us, and they were not giving them, they have approved to be giving us 1% every month. And they started this month that we are in. Next slide, please. So that is our new office complex. That's where we are now in Osun State. And it's one of the most beautiful in Nigeria. The governor greeting my royal father during the commissioning. Dr. Ineye was with us when we were doing the commissioning. In fact, he has always been a very good partner for us in Osun State. There is no program I do that he will not come. Next slide. Yeah, that's Mr. Governor registering, enrolling the pensioners. Next slide. That's the surgical intervention sponsored by Rotary International. The governor was there to declare it open. He was also dressed in surgical attire, and I gave him blow and knife that Oya cut. Next slide. Yeah, that was when we distributed the life support gadgets for the people living with disability in Osun State. Quite a lot of them. You will see Dr. Yene there. I was standing close to the governor. Next slide. Yeah, that's when we distributed the glasses. That's my governor, Imole, and with the students. Thank you very much.
Thank you very much, the Executive Secretary, Osun Contributory Health Commission. Thank you very much, sir. Osun, the best state after Ondo. Yes, the last but not the least, Oyo State, the pay-setter state, the hometown of Dawn Commission. You have 50 minutes because you are the home of Dawn. 50 minutes.
Okay. Thank you. Permit me to stand on the existing protocols. Okay, next slide. For your state, the agency was established in 2015, and the flag off was in 2017. We have 5 directorates: admin and human resources, planning, research and statistics, finance, technical operations, and marketing. And we have some units: claim management, monitoring and evaluation, client service, media, digital marketing, and quality assurance. For accredited facilities, we have 463, of which 89 are private facilities, 38 general hospitals, and 336 primary healthcare centers. We have the following documents: the law, the operational guidelines, and the benefit package. So far, we have 259,962 active enrollees. That is about 3% coverage of the state population. And we have 2 basic plans: the Universal Health Coverage Plan and Top-Up Plan. Those are the 2 basic plans we set. Now, for the Universal Health Coverage Plan, it is further divided into 2, individual and family. And for the family, we have divided into 2 also, a family of 4 and a family of 6. Now, the premium differs for all of this. Then we have windows through which you can come on the scheme. Is either you come on the conventional scheme, or you come on through the community-based health insurance scheme, the basic healthcare provision fund, the adoption model. Then you have the saver scheme, the pensioner scheme, and student plan. Now, may I say this? The saver scheme is the same thing as the basic healthcare provision fund. The only difference is that, of course, we know the basic healthcare comes from the federal government, but the safer scheme is solely paid for by the Oyo State government. And as we speak, last month we started enrollment for the safer scheme. What the government did was to pay for 50,000 lives. So we are currently enrolling that. And the enrollment is taking place in every ward in the state. In Oyo State, we have 351 wards. So what we simply did was to divide that number, 50,000, by 351. So whatever we get is what we are enrolling in every ward. Because the state government has done something. They have renovated primary health care centers in every ward in the state. So we have facilities to actually enroll these enrollees into. So, and that's what we are doing. And in doing that, the enrollment, we've talked about the SOKU list, the authenticity of that. But we are not solely dependent on that. What we did was, before the enrollment, we called all Ward Development Committee members into a meeting, and we enlightened them. So we are actually working with Ward Development Committees to do the enrollment, so that we get more of the poor, of the vulnerable people into the scheme. Our target for this year is to enroll additional 500,000 lives into the scheme. Now, we also have target group enrollment. Widows. We are working with the Ministry of Women Affairs to enroll widows. We've enrolled street sweepers, those employed by the government to clean the streets. We've enrolled them into the scheme, about 1,000 of them. We've enrolled people living with sickle cell and HIV into the scheme. We've enrolled people living with disabilities. In that enrollment, we work with the Justice Development and Peace Commission of the Catholic Church, because they work with their cluster groups. So we work with them to get the enrollments done. And we've enrolled, of course, with the assistance of UNICEF, primary school pupils. We enrolled 10,000 of primary school pupils. That was flagged up this year, and they're already enjoying the scheme. Now, innovations. We provide bailout for providers, direct renovation of hospitals. Before the government took over the renovation of primary healthcare centers, the agency in Oyo State actually renovated 15 primary healthcare centers and 2 general hospitals before the government took over the renovation. Of course, we also employed doctors paid for by the agency into some of these primary healthcare centers. As at the last count, we employed 57 doctors. But the good thing now is, with all what the government is doing, the Oyo State government has just employed 4,000 staffs into primary healthcare centers. So to bridge the manpower gap in the primary healthcare centers. The agency will soon commission a diagnostic center in one of the general hospitals to be run by the agency. We want to use that as a clearinghouse because of tariff gaps from different diagnostic centers and hospitals. So that's the way we are thinking. That when there is this dichotomy, we'll be able to send the enrollees to a diagnostic center run by the agency. And of course, in our top-up plan, we have 2 top-up plans, one of 50,000, and the second one, we call it top-up 2, goes for 108,000 per annum. Those on the top-up 2 plan enjoy comprehensive medical checkup annually. So that plan goes for 108,000 per annum. So we have enrollment and service enablers. Of course, we have our Usher app. You can download that on Play Store and iOS. You have the USSD code. You have an active website. And we have local servers. Like the server enrollment that is ongoing now, they get their ID card on the spot. So there's no go and come back. You get your ID card on the spot. And we have also launched our EMR service to ease payment and give providers more confidence in the scheme. Marketing strategy. We are active on social media. We have our podcasts. We have on Twitter, on Instagram, on TikTok, and we also have an Oisha TV on YouTube. You can watch our activities, our adverts, everything you need to know about Oisha. Is either you go to our YouTube handle or you go to the website. Then we are active on radio and TV on a weekly basis. Radio and TV on a weekly basis, you see us there. And on our radio and TV activities, we give room for people to call in and ask questions. They can even report hospitals live. And what we tell them is, if you decide to call in to report any hospital, don't hide the name of the hospital. Say it and let people hear it. And I need to say this, and that has kept hospital workers on their toes. There was a particular event I remember The then Commissioner for Health was listening. We didn't know. Then somebody called from one of the general hospitals. The wife was pregnant. They were in the hospital for delivery. Nobody, no doctor, no nurse was on duty. So as the commissioner was listening, he just took his car, went to that hospital. Of course, we referred the patient to another hospital. The delivery was done perfectly. But the commissioner took the case up. And since then, we've never heard that case again in that hospital. So these are some of the benefits of some of these radio and TV programs. Then, of course, as part of the safer health enrollment, what we did was, and in part of our ability our desire not to leave anyone behind, we also enrolled inmates of the correctional centers in Oyo State. In Oyo State, we have 3 of them, Ibadan, Oyo, and Ogbomoso. They've been enrolled into the scheme, on the scheme. So we've had a lot of politicians, philanthropists coming on board to enroll people. You can enroll any number. And the governor promoted that a lot. In fact, our chief adopter is the governor himself. Because himself, he paid for 4,500 lives last year. So anywhere he goes, you always talk about it. And people have been responding to that. So what we did is, our universal health coverage plan is 18,250. But if you want to adopt, we allow you to pay 13,500 to also encourage you. So it is the agency that will make up the rest. So we do this a lot, and people have been coming on board. Something the governor did again, 3 years ago, we put pensioners on the scheme. What did we do? The premium then was 13,500 naira. So we approached the Nigerian Union of Pensioners that we want all pensioners, you serve the government, be on the scheme, but you will not pay 13,500, but you pay half of that. And how are we going to get that half? You deduct it 1,000 per month from your pension. So they agreed, and they started. So in the middle of that year, the governor decided to take up the bill. So he paid for the following year, and the previous year they paid for, the governor refunded. And since then, the governor has been paying, even up to date. He has been paying for all pensioners. As at date, we have registered 44,200 pensioners paid for by the government. So if you look at it, 44,000 pensioners, he has paid for 50,000 lives, and he has also adopted 4,500. So that's what the governor is doing. So, but in all we are saying...
5 minutes more, sir.
Okay, sorry. In all we are saying, one thing that comes to my mind is, one thing we are overlooking is the political will. A governor is doing that. If the next governor comes in, will he continue? Will he continue to pay all of that? I think that's the problem we have mostly, that we are not looking at. That's just by the way. So we have pictures at the correctional center. That is a picture from the correctional center. Followed by pictures from the safer enrollment of primary school pupils, renovations of hospitals, registration of street sweepers, our mobile app, equipment supplied to some hospitals, and we have a dedicated call center that operates 24 hours. The number is 07,697. 07,697. So you call that any time of the day, you get an answer. Okay, next steps. We are onboarding dependents of civil servants. Now, all civil servants on the scheme before now are just the staffs alone. So we've just reached an agreement with labor in Oyo State that dependents of all civil servants are coming on board. That will start in July. So the challenges are the political will to enforce the mandatoriness of the scheme. On paper, it is mandatory, but to enforce it, the political will to do that. And of course, we have provider challenges. It's across board. Some have been said here. Decapitation is small. Cost of medical commodities is on the high side. How are we going to bridge that gap? If you increase premium, people will stop subscribing to the scheme. So how are we going to go about it? Then part of the challenge is reaching the unreachable, breaking distance barrier. In the cities, it's easier to get information to people, but in the rural areas, there are some parts of Oyo State, when you get there, you will not get the network of Nigeria again. You'll be hearing radio stations from Benin Republic, no longer in Oyo State. So whatever you do on radio, they are not hearing you. Education of the grassroots indigenes. Ability of doctors and other medical practitioners to meet the teeming insured, to meet the needs of the teeming health insured population. Then capacity building among our staffers of primary healthcare centers. Thank you.
Thank you very much. Please let's put our hands together to all our presenters. Thank you so very much. Don Commission, over to you.
All right, thank you so much, sir. Thank you so much. Just to round up so that I can go for our lunch, and then tomorrow we'll treat some of the issues that have been raised. But just to do a kind of recap and to prepare our mind for tomorrow, what we're going to discuss tomorrow, because it's very important that we are on the same page as we are leaving this place tomorrow. So we've listened to all conversations, every presentation, and the opinions there. So tomorrow we are going to be looking at some of the challenges that resonate across board, and all of us in the room also will profile solutions that we'll find a way to implement ourselves. We'll share ideas, we brainstorm together on a likely or possible solution to some of those problems. And as in other states, some of those problems are being solved. And so this state that already solved the problem will share with us their solutions, and then we'll see the possibility of replicating such solutions in our state. So tonight we're going to look at all the challenges that have been highlighted, compile it as the challenge of health insurance in Southwest Nigeria. It's not going to be a state, and so states, people in attendance will help us to, experts in attendance will help us to profile solutions that we can go back and test at home. We also, even though may not happen tomorrow, but we also want to do an interface with the Ministry of, facilitate an interface with the Ministry of Economic Planning on the social register, because even beyond the health insurance, these social registers, as Don Commission will challenge the NASCO managers during President Buhari's tenure, when we saw the breakdown of intervention in Southwest, and what they told us was that is so. We saw that the numbers of people that got intervention from Southwest were very low. So we talked to them that what happened. They said that was what was presented from our states, that they didn't manufacture the numbers. So because Southwest seems to be, not even seem, Southwest was the lowest region that benefited from those interventions. So we want to look at that register and see, learning from what UNICEF is doing to see how we can strengthen our register, because that's what World Bank is also using for their palliatives also. So there's a need for us to look into it and strengthen it. And again, we also want to, I think it's the NME chairman that says so, I think, and I see the reason with it, to say that there's a need to also understand why people are not enrolling, scientific understanding, not guesswork. So we also see as an entity, as a COP, as in Community of Private Education, to see why people are not really enrolling, even when it is free. Like the PS said the other time that when they got to the villages, people are running away or they are not. So we need to understand and then begin to address those things. Address it. Let's have that scientific understanding of what is happening in those spaces. And also, as a COP, we want to also do a collective advocacy. A state said that they have not gotten their equity fund. If you go as Southwest Health Insurance and say, please, maybe to the commissioner or to the governor, you can secure that appointment and say, please, we are here to plead on behalf of the state to say, please, what can you do to engage this? So if you go as a collective, to do advocacy, to also help, don't commission will part with the other health insurance heads will also join us to do the advocacy. Of course, we want to sincerely, okay, maybe I should take that on to the last. Then there's going to be lesson sharing by Ondo State. I said it earlier, Ondo State SA, because the senior government official in the room as representing the governor. So I want to crave indulgence that when we have the commissioners, you help us talk to them and also share some of the lessons that have been shared here today and let us. So we're going to plead with you that we'll look for a day. We'll inform you ahead so that we can bring the commissioner together virtually and help us make a case to them on the need to support the health insurance to further support health insurance in their states. Then we are also thinking, like say, creating a path for an integrated health insurance scheme. Ondo, Ogun and Lagos are already doing, like the presenter from Ogun said, they will give us the example how that has happened. We can also learn from it. There's proximity between some of our states also, Oshun, this is Owena there, Oshun and Ondo states, there's that proximity too. There's also a way to also look at how to integrate that. Instead of coming all the way, maybe there's a way you can just branch in Oshun if you are in Owena to access healthcare. And another interesting thing is what the Oshun Executive Secretary said about publishing academic papers. Let's be sincere with ourselves. There are dearth of academic papers on health insurance locally. You will see World Bank will do there, but when you're looking at the local context, you'll probably not be able to have. So I appreciate the fact that they say they are doing that also. We should also encourage. Let's partner with the academics in our states to see how we can publish papers on some of those things, like the issue that the NMA chairman mentioned, the issue of people not enrolling when it is free. We can have, it could be a project for an MSc student or a PhD student in a university, and that will help our knowledge also, to get it done. And lastly, for today, we want to sincerely appreciate Ondo State and particularly Dr. Abiodun. Please, a round of applause. So we've pushed. Please let's just do more because we have lunch, and maybe some of us will not get meat because we are not appreciating the host. Because we've been struggling since to host this meeting, and they eventually volunteered to host it for us, and we are very appreciative of that. And we want to implore other agencies to please that we want to make this a regular thing. We want to make the regular. I know that Dr. Oyelenya has made it big. Well, if you cannot afford this big, you don't mind to stay in a room and just do it, but just meet regularly, so that we continue to have this learning, this understanding of things, and then before you know, health insurance will become a culture in our region. So thank you so much. Tomorrow, please let's come and look at all these things, and by 12:01 latest, we are out of this place. Thank you so much.
Thank you very much, Mr. Ladipo of the Dawn Commission. Closing remarks by the DG, Contributory Commission on the State, Dr. Abiodun Oyenayi. Thank you. A round of applause for him, ladies and gentlemen.
Your Excellency, Dr. Loki Orimisan Ayedatiwa, ably represented by the essay on health, Professor Simidele Odimayo. I think we all deserve a round of applause to To me, today has been a very great day, and I'm glad that this conference, first of its kind, is this big, and we'll continue to ensure that we make it in that strides to continue to have the kind of conversation that we require to advance attainment of universal health coverage. I thank Dr. Okunla for the well-delivered presentation, and also the representatives of UNICEF. It's a piece of information because social register had been a narrative for the past 3 years, thereabout. World Bank also has been pushing that there must be a register validated that we can all be proud the level of data integrity that we have in there. The State Operations Coordinating Unit under the Ministry of Economic Planning and Budget for the state, Barrister Bankole, had been invited to be with us tomorrow. He will be able to shed more light. I'm privy to the information that there have been constant validation of that data. But you know, there are some issues that we really need to address. It has to do with funding, it has to do with political will, it has to do with commitment. Because if you say you have children that are under 5, age is something that is dynamic. So if somebody is 4-year-old to this year, by next year it will be 5, it will become 6. So that database is dynamic. UNICEF also alluded to the fact that we are highly migrant because people are looking for economic viability. So people that live in this world, in 3 months' time, you'll be shocked that you not find them there. And when we talk about coverage, the narrative is around residents, not actually indigenous citizens of the country. So if you have a resident that is residing in Ondo, in 3 months' time, you'll be shocked that that person could have moved to Oyo State, or could have moved to Lagos State, or the Oku could have come from Bayelsa to take that boy home for education. So those are the issues we would like to engage in to see how do we ensure that at any point in time, real time, we have a register that is realistic, that speaks to the reality of the state. I would like to thank all the states for participating. It shows the level of commitment for all the states to be well represented here. I know what it took done since last year to put us in one room. It was a tall task because there are so many programs happening at the same time. Even done, there are so many activities that they are involved in. I just want to appeal to us that we should please try and come 9 a.m. tomorrow because quite a number of the delegates will be traveling back to their destination. I would not want them to travel late. So let me now give the vote of thanks to thank His Excellency, ably represented in our midst. I would like to thank the representatives of the SSG, the representatives of the head of service, Mr. Bayo Philip, that is currently in Abuja. I thank all the permanent secretaries that have been with us, especially the permanent secretary, Local Government Service Commission is still with us. He's been here since morning. I'd like to thank the NMA President Ondo State Chapter. I'd like to thank the PSN Chairman. Thank you so much for being with us, sir. I'd like to thank the Permanent Secretary Hospitals Management Board for always being with us. Of course, we are your biggest customers. We don't have a choice. And we hope that the issues that are being raised in terms of healthcare workers, which Mr. Governor definitely is looking into, will take it, will nudge it a step further. I would like to thank all the directors from all the agencies in the health sector. More importantly, I would like to thank the board members of the Hospitals Management Board. They were with us yesterday and they are also still with us today. You know, we are helping them to help us. So we enjoy the collaboration that we've been enjoying, and we commend the effort that they have put into ensuring that our government hospitals become centers of excellence. To the directors of the Ondo State Contributory Health Commission, ODCHS, we are all looking smart and we are all looking orange. And I really appreciate everyone for coming. The chief in our midst, representative of the CSO, we really appreciate you. Seated with us this morning. It's been great. From OD Saka, we really appreciate you. Regards to Dr. Adegbolu. To NHIA, our regulator that decided to sit quietly and does not want, currently the DG with the management team of NHIA, they are having a 1-week retreat. And if we have moved this program, we may never have it. And they send their apologies. They would have loved to be here. And that's why the state coordinator also is in Lagos at the moment. So they are having a 1-week management retreat in Lagos. That's why they are not here. But they have a representative. Please, can you stand up for recognition from the NHIA? Thank you so much. We moved him forward. He decided to sit at the back and regulate what we are doing here so that he can give the helicopter view of what transpired at the conference and give a feedback to the DG. And I must commend the DG of NHIA. He has always been with us. He was with us during the flag off of the informal sector scheme for Ondo State. Please help us pass the message across to him that we appreciate him. We acknowledge his effort. And like one of us mentioned here, we are also waiting for the disbursement of the BHCPF 2.0. So we hope we'll be able to get alert before we leave this conference so that we can go and enroll more vulnerables into the health insurance landscape. To the Lagos delegate, we thank you. To Ogun State delegates, we thank you so much. To Oyo State delegates, we thank you so much. Ogun State delegates, we thank you so much. Delegates from Ekiti, we thank you. And the delegates from Ondo State, we thank you. And delegates from Oshu, I hope I didn't leave that one. We really, really thank you. ES, Ondo State Drugs and Health Commodities Management, we thank you so much. We thank the Emerald Expressions. They were with us earlier on, giving us those wonderful vibes on the oranges. I hope we'll be able to play it before we leave this conference so that we can memorize it and take the message across to our people that the informal sector scheme is operational, the forms are outside, our director, BDCR, is by the door, ensuring that if you don't have health insurance cover, there will not be any launch for you. So no Ankara, no Semo. I think he's going to implement that executive order. And I'm sure the special advisor on health will be able to give an endorsement to that. So can we all give the special advisor on health a round of applause, please? Professor Simidele Odemayo. We are still looking for another name to qualify him. He's a man with 9 lives. He's so energetic, full of life. Even before the program, he came here to ensure that everything was in order. And he has seated with us quietly since morning. We really, really appreciate you for the leadership, your leadership style, for the support that we have enjoyed. And I'm sure when Mr. Governor is back, Mr. Governor will also be very excited that Ondo State has hosted the Southwest, and he will be glad to share the experiences with his brother governors also across the Southwest. To the chairman of the private practitioners, we thank you so much for being with us, and we hope that the collaboration will continue. Please, let's enjoy our meal. For our delegates, let's enjoy the savour of Ondo State. Please don't be in a hurry. We'll take a ride to see the ongoing project of our permanent site after this exercise, so that you can take a peep. And we hope when next will be coming shortly. We'll be inviting you for the official commissioning of that project, which will be more beautiful than that of Oshu. We hope. Thank you so much for coming. I wish you safe journey to your various hotels and destinations. Please, let's make 9 a.m. 9 a.m. tomorrow, because we are going to kick off by 9 a.m. so that our delegates can also travel to go back to their destination. Thank you so much, and God bless you all.
Thank you very much, the Director General Contributory Recognition on those states, Dr. Abiodun Oyeneyin. Thank you very much, all the distinguished participants. I wish you a very beautiful evening in Akure, the state capital of Ondo.